Hey there, I'm Gilad Barash, and welcome to Who's Your Data, the podcast that deals with how data influences life and how life influences data, the human side of data analytics. Hey everyone, welcome to a special episode of the Who's Your Data podcast. Did you know that Black women are 3 to 4 times more likely to die during and after childbirth than white women, and that 80% of Black maternal health issues are preventable? April 7 marks the beginning of Black Maternal Health Week, and to honor this important topic, I have a chat with Bianca Pryor. Bianca is a VP of Consumer Insights at BET Networks, but also the co-founder of the Dr. Shalon's Maternal Action Project, a nonprofit organization that seeks to empower women of color to reach out and find support in their community utilizing an innovative app called Believe Her. Bianca tells us Dr. Shalon's story and how she herself became involved in this endeavor, and how she brings big data and her expertise and insights to tackle this important issue. We discuss the importance of cultural sensitivity and representation in healthcare, as well as in market research, where Bianca delves into how she thinks about segmentation for the BET audience. So let's get to the conversation. Welcome to the Who's Your Data podcast. It's great to have you here.
I'm so glad to be here. Thank you so much for having me.
So you are a VP at BET Networks that does insights and multi-platform analytics, and you are also co-founder of Dr. Shalon's Maternal Action Project. Can you tell us a little bit about your journey in analytics and what's brought you to this point?
This journey actually, it goes way back a lot. It goes all the way back to graduate school where I went to pursue a master's in consumer behavior. So it's an interdisciplinary degree between economics, marketing, psychology. So really trying to unpack the why and how a consumer buys. What I wasn't too clear on when I actually started this program was that Purdue is a research one, a top tier research one institute. So what that meant is that it was a thesis granting Masters of Science program, which meant I had to run my own research in order to graduate and conduct my own research. So I had to learn SAS, I had to learn SPSS throughout my program. And that's really where I got my first chops in like working with data sets like the Survey of Consumer Finances and other data sets. And it was eye-opening for me. And I think that's where I really fell in love with the pursuit of data and analytics. And but then the journey began of trying to make meaning behind all of this big data. And then I had to figure out on top of that, like, oh, like how do I use this degree? And that's where I landed in industry on the market research side, vendor side. And I got my first start at TNS, and I had a mentor there, and that mentor was actually someone on the advanced analytics team. And that's, I think, where it really came together for me. I was like, wow, I love waiting. I love figuring out how to build sample. And I really, really started to pull in what I had learned in graduate school and play around in SPSS and bring all of that back to life and put it into practice because I was on the brand tracking team. So that's where I'd say, from academia to industry, that's how it really came about for me and fall in love with it.
That is a very interesting trajectory, like you said, coming from academia and into industry. One of the things that I wanted to talk to you about specifically in honor of Black Maternal Health Week that is taking place between April 11th and April 17th is around using technology to address Black maternal health. Can you tell us a little bit about Black maternal health issues in this country and how you came to be interested and involved in them?
Absolutely, yes. So I have become deeply involved and entrenched, rather in the Black maternal health space. And I start by saying not by choice, and that's true. It's through a very deeply and tragic personal experience. So this goes back to 2016. I found out I was pregnant, and my best friend was also pregnant. And this is my best friend, Dr. Shalon Irving, or Shalon. And we actually met when we were at Purdue. So that's the through line there. And while I was in industry making my splashy career in market research, she was professor as well as a esteemed fellow at the CDC, and she was an epidemiology fellow. And so we were both pregnant, and 3 weeks after she gave birth to her daughter, she was not feeling well at all. And our lives were intertwined in that way. And I had just given birth to my son, who was in the NICU. So all of these issues and complications started to surface for the both of us, and which, you know, I'll speak for myself, I was not 100% aware what I was facing. So I was considered advanced mother age um, when I gave birth to my son, but I guess I really wasn't aware of the statistics that were in front of us. And the statistics being that Black women are 3 to 4 times more likely to die during or after childbirth or experience some kind of complications compared to white women or white birthing people. And we kind of fell in that grouping unknowingly. And unfortunately, my best friend Shalon was on the mortality side of this. And that was hard. It was incredibly hard to
I'm so
experience.
sorry to hear that. That is, such a profound and impactful reason to be involved in this. Can you tell us why it is that Black women tend to be in that statistic?
There are many reasons, but unfortunately, some of the main reasons behind this statistic is racism. There is obstetric violence. There's implicit bias. There's quality of care. Sometimes the birthing person has underlying conditions. So there's many different reasons, but we do know that Shalon's death was preventable. It was absolutely preventable, considering that she did advocate for herself. She did speak up for herself. And her and I had text exchanges where I was telling her, like, girl, having swollen legs is not normal. Like, please push back on your provider. So you feel helpless, though. You feel helpless in especially American medical industrialized system. There's so many layers. Are you going to go to your outpatient? Are you going to go to OB-GYN? Are you going to go to your high risk doctor? Who are you going to lodge this concern with? And especially if you don't feel heard. And I think that's the issue a lot, is that you don't feel heard. So who do you go to next? How do you continue to elevate your pain and suffering? And who is truly going to listen to you and then take action? And unfortunately, Shalon fell through that net and wasn't cared for, taken seriously in that regard. So, to answer your question more precisely, that's how I've fallen into this work, and putting all of that pain and that struggle into a real purpose, and to help, Wanda, who is Shalon's surviving mother, and to help her, develop a foundation, develop a 501(c)(3), develop technology that can help, close these gaps in theory.
And so, as someone who has taken data and analytics and technology into this nonprofit space, how, in your mind, can data and technology impact the Black maternal health crisis and Dr. Shalon's Black Health Foundation specifically? And can you speak about the Believe Her app that's been created and what its role is and all that?
Sure, absolutely. So when I think about, my very personal experience, and Shalon and Wanda, and Shalon's surviving daughter Soleil, I think this is one best friend, one family story. And I think those stories are massively important, right? To humanize the data, you need that. But then there's the big data side. And that's where policymakers need to see it. That's where investors need to see it. That's where partners need to see it. So if you're building something, you need that data to be able to command and make the case and say, there is a there, and this is what the data is telling us. And it needs to be quantifiable, and you have to be able to look for those data patterns, whether it's you're checking for, postpartum symptoms, or if you're looking at quality of care, if you're looking at maternal toxic areas, you need that data to be able to make the case for why some type of social care program might be needed, or like for the Momnibus, for example, that bill package has continued to grow over time. And that is, you know, backed by data. You're able to draw those connections to say there's actually a need here. There's maternal toxic areas throughout the US. So we're going to put some safety bundles, or we're going to put some care, behind those particular areas. So when it comes to technology, absolutely, like that came to me. I actually went to Afrotech. It was November 2019, and I was so inspired by being in Oakland and by being in a space where there was so much like brilliance there. And I felt like I was in the future. And I remember scanning the exhibit floor, feeling like, but no one is here talking about Black maternal health. And for me, that was the wide open space. And that was like the spark for me. And I was like, and I went back. I remember feeling so inspired. And I huddled with Wanda and I said, I think we can do something here. So that's where we began, did our landscape to see who else was playing in the space. And there weren't many. At the time, there was Earth. So that is Kimberly Aller's app, which is a fantastic app. She's definitely a pioneer in this space, that, basically calls in different providers and healthcare facilities that aren't delivering, adequate care. There was Zola, which was founded by three students over at Yale, and it was actually like a competition project that they had developed, and it was like full spectrum, so gave you resources from pregnancy all the way to the fourth trimester or postpartum. Then there was Mommy, which is Mark Cuban and Serena Williams joint venture app, but that was more for like patient care management. So for us, it was like, well, we felt like we could just step right into that space and offer a peer-to-peer empowerment app. And we called it Believe Her. And we thought that, with a name like that, and just in thinking about Shalon's life and story, it felt like that's exactly what we wanted doctors and her providers to do, was to believe her, to truly believe that she was in pain. So that's why we named it that. And but it's incredible, God, that there's just so many collaborators in the digital health, specifically maternal health, Black maternal health space now. Like I can't even name them all, and it's only been a short 2 to 3 years that, there's just a burgeoning of tremendous apps out there for Black birthing people. And I'm happy to see it. I'm here for it.
Yeah, that's really encouraging that that's taking on. So as a peer-to-peer support app, you'd say Believe Her is basically a social network that allows Black birthing people to share their experiences, talk to each other, encourage each other, basically put more weight around, for example, the support that you tried to give to Shalon, but have more volume around it, and that maybe it will move the needle more.
Yeah, that's exactly the vision. We wanted it to be simple. We wanted it to be accessible, to break down those barriers that, Black mamas and Black birthing people might have been experiencing or facing. And when we were developing our app, envisioning it, roundabouts, we spent a lot of time, wireframing and talking to partners and figuring out what this was going to look like. And we locked arms with Jeff and Dion over at iRelate, and essentially decided that to get out to the marketplace, quick and fast, we wanted to white label something. So we partnered with them, and they already had an existing base platform. And we figured we could build Believe Her, skin it ourselves with our look and feel. So you'll notice like the yellow and the brown colors that really do lean into our visual identity. So partnered up with them, and we loved about their platform is that, one, it's anonymized. It's like you go in and create your handle, and all of our terms are very clear up front, terms of service, privacy policy, all that. And you go in and then you can select which room that you want to, share space with someone. And, maybe in this community, there are aunties, there are other best friends, there are other birthing people. That, and the idea is to essentially push and pull and co-create like a conversation where you can get collective wisdom, but also that you can give that back too. So, and we wanted that to happen organically. And again, the idea is that an emergency waits for no one. If you need to jump into the Believe Her app and you're feeling like your legs are swollen, you haven't experienced the symptom before, you're, let's say, 4 weeks postpartum, and you don't want to put it out there on Facebook and in a mom's group because you might be recognizable, we feel like we truly believe the Believe Her app could be that for you.
And I think
That
you get enough, like you said, this common wisdom, and if enough people are telling you, no, this isn't right, you need to go get care now, it will just cause more motivation to address it. I think that's really beautiful. And I think, now from a data perspective, I can't help but think about it, okay, what kind of data
Sure.
are you collecting?
Yeah.
I think it's really fascinating that you are recording and collecting this sort of, cultural wisdom
Mhm.
that is passed down by friends and aunties and people who have given birth and their experiences. What do you envision then doing with this data in terms of like thinking forward to the future of this app? Are you seeing, what use cases do you see doing with the data? Does AI play a role here? Are you thinking in terms of working with partners? Like, what would you take this data that is this collective wisdom, and what would you do with it?
It's a great question, and I think it's one of those things where you put something out into the world and launch it, and you wait and you see what the response is, and you're studying, observing the data. So for us, there are a few measures. It's the typical app measures. We were looking at how many downloads did we have? How many people actually logged in? And then within that little universe, how many people were actually active? So when you get to kind of like the active user base, what we found is that in an initial months, we had like a strong start. And then there was a softening, right? And there are many reasons for that softening. I think there's some external factors, there's some internal factors, and I think Juana and I have learned a lot about what we would do in 2.0. So that's exactly where we're at now, Gilad. Is like we're ready to think about what the next level of the Believe Her app could be. And so, but back to 1.0, for us, it's massively insightful to just look at the different conversations that are happening in the rooms. In particular, there were some interesting conversations happening in one of the rooms around just economics and financials, and some just honest, transparent combos about like the cost of birthing a child, and the barriers of insurance, and all of those type of maybe not socially acceptable conversations, over dinner or coffee, but they were happening in the app, and that was massively insightful to us and telling us something. Um, so because we do not, sell the data or, use it for marketing purposes, we certainly treat it very preciously. But I think in the future, when we think about a 2.0, I think that there's a lot of product roadmap developments we could make, including AI. And I think if you think about this community and the spirit of it, which is like the collective ancestral wisdom of Black birthing people and those around you that just really wrap their arms around you, you know, there's I think, a huge opportunity to lean into natural language processing. So subdomain of AI, machine learning, nested with machine learning is, NLP. And I think that we could do a lot there. We could do a lot there, whether it's text or speech, and trying to decode and to make meaning behind if somebody says, "Child, my legs are just swollen today. I am not feeling right, girl." Like if you think about putting something like that in Chat GPT, I don't know that it would be interpretable in Chat GPT. I
Hmm.
don't know that. I haven't validated or tested it. But if there was something that could pick up on, dialectical differences or the colloquial, through NLP to look specifically for like, was that a warning sign or in colloquial, or like what, like how do we start to unpack that from a NLP standpoint?
Yeah, I personally I think that the future is going to be very personalized LLMs that are trained on segments of data. So, envisioning something like a Black Maternal Health chatbot that gets trained on this data, which would exactly give it that view that it
Mhm.
wouldn't get from general kind of medical documentation. The combination of both is what would give it that edge that would be so helpful. So I think that there's a lot of great potential in accumulating this data that there's nowhere else to get it, that is the
Mhm.
kind of cultural, conventional, generational wisdom of
Yes,
the ancestors. um, to
absolutely.
to include that and layer it over the kind of mainstream medical knowledge.
Absolutely. And I think there are so many ways to go about that too. Is like if you think about the bigger ecosystem, in the Black maternal health space, you have midwives, you have doulas, you have patient care navigators, patient safety officers, providers, pairs, like the list goes on and on. It's so interlocked. And if you could think about all those as like dyad conversations, and how you get the listener and the sender of the language of communication. And if you could just unlock that or kind of replicate it all those different ways, that could be really, really powerful and very guiding. And, I take it back to, I think it's 80% of Black maternal mortalities are preventable. So if that's the case, then what is happening there? It's and how is it that we can use advancements in AI, machine learning
Mhm.
um, to help, close that gap?
Yeah, I think that, like you said, in the last couple of years, with the advancement of not only health tech in general, femtech in particular, and within femtech, the sub niche of Black maternal femtech. I think
Yes.
I agree with you. I think it's a very exciting time now that we're going to see a lot of movement in the space that is going
Mhm.
to address these preventable deaths. That's amazing.
Absolutely.
Um,
Absolutely. It's so needed.
And I wanna take a step back, and the theme here, of course, is that cultural sensitivity is crucial when we're doing medicine and when we're doing anything, including consumer insights. And I want to
Mhm.
turn for a minute to your day job as a VP at BT and ask you, because this is something that is interesting to me coming from the ad tech world, market research world. I know in my experience, personally in media, I've always noticed that there's a tension between being able to sort of accurately identify an audience versus avoiding stereotypes, but also being privacy friendly. So there is an effort to be sensitive to representation because it matters so much. Can you talk a little bit about how you think in general about Black representation in the data and how it's changed in the past years? I mean, I expect that, BT collects a lot of data about its consumers and it's unique in the market. And how does BT think about representation when it comes to consumer insights?
Absolutely. So our strap line is that we are not a monolith. And I think that is a very important strap line when you just pause and think about, the 14% representation of Black Americans. We're not a monolith. We there are so many pockets. I grew up in Richmond, Virginia. I now live in the Bronx, but I also lived in Chicago. And I also identify as Black and Mexican. So that just even taking my own lived experience, there's so much there and so many different ways you could slice and dice it geographically, my Latinidad, racially. That's just a survey of one. Do that across, the millions of folks in the US, and you would reveal the exact same thing. And I think it's honoring that and recognizing that and breathing life into that. And so when you do that, you have to say, what does that mean from a briefing standpoint? Just a simple research brief standpoint. Where are the points in which I'm gonna challenge these assumptions about universal Blackness? I'm here, sampling is going to be a great place to do that. So what is my sample frame going to look like? Who am I going to go after? So typically at BET, we generally go after African Americans 18 to 49 because that's our paid audience. That's what we
Hmm.
call it. Meaning that the advertisers are most interested in those viewers. So we typically start there, but then we're building out from there. Are we going after a particular genre viewer within that? Are we going after, we could even get more specific, like are we going after a particular title level viewer? Maybe it's someone who'd seen 5 seasons of Sisters, which is our number one show across cable TV. So there's many different ways to look at this. But then you have to think about, where's the growth opportunity? Where's that at? Is that at a DMA level? Is it at a LGBTQIA plus level? Is it at an abilities level? So there's so many different ways that, and we have to train ourselves to challenge those assumptions and say, nope, we're going to sample differently. We're going to get some over quotas, and we're going to make sure we get a quantitative point of view here.
I've seen that in creating audiences that you really have to battle the assumptions that any group of people is a monolith.
Yeah.
And it really, at the end of the day, is about their behaviors and how those behaviors predict their likelihood to be interested, their intent for interest in a topic and a brand, etc.
And we do that, we have also experimented with taking it a step further and just not doing it off of, a sample frame built off of demographics, but we do push harder and we do have our own segmentation that we are quite proud of. And I've had the pleasure of like working on this segmentation for many years now. And it's built around the linear TV audience, but then it's broken down. We did some really cool advanced analytics to shake out some different clusters, and the clusters are very much driven by need states as the top dimension, and then below that there is another dimension, but we're able to see like, oh, okay, when let's call them segment A, when segment A shows up for our number one franchise show, we know exactly why. We can say, oh, they like the fashion or the beauty in that
Mm-hmm.
um, particular franchise. And it just starts to all make sense when you can look at it that way beyond just demographics.
I always had a challenge in explaining to advertisers and to ad agency people that came wanting to target demographics, that they were missing such a huge, that's kind of a traditional way, but missing such a huge part of the story. There are behaviors that transcend demographics. And,
Yes.
for example, in a case like with the Believe Her app, if you're looking at maternal, Black maternal health, that doesn't mean that if you were targeting, you would necessarily only want to target Black women of a certain age, because there are their caretakers, their decision makers, their
Yes.
friends, their family.
Yes.
There's so many other people that are involved in the thought process and decision making that you want to consider them. So it's more about behavior than it is demographics.
Definitely, 1,000%. Yes, you've got to lean into that. And I think too, it's important to also sit with, the why as well too, and try and unpack that to the extent you can. Beyond just the quant, it's great to have that, but to get the qual and to hear it in their own words and have them articulate that. And going back to the genesis of Believe Her app, we actually started with a key piece of qualitative research to guide us and to really unpack. And I think one of the most profound things I heard was this universal feeling among the Black birthing um, people, the mamas. They were saying that they felt like they just wish they had a little longer in the hospital postpartum.
Really?
And it's typically 2 to 3 days, it's like standard level of care postpartum. And they send you on home. And there was a resounding, I just wish I had a few extra days. And when we unpacked that, a lot of there was concern and there was fear based. There was, wishing that they had extra eyes on them and the baby to make sure everybody was okay and
Hmm.
steady. So if we could kind of reimagine a world in which that was okay, we had a medical industrial complex that provided that, especially to the most vulnerable populations. Imagine with that statistic of 3 to 4 times more likely, would that still hold? I don't know. But I think it's that imagineering. It's that, what what could we do differently in the system so that these deaths don't happen or these morbidities and complications.
Absolutely. We have to dare to try to ask the questions and see where it takes us. And
That's right.
speaking of where it takes us, looking forward, we're already kind of it's the end of Q1
Mhm.
in 2024.
Yes.
But looking forward in 2024 in terms of representation, culturally sensitive engagement, whether in maternal health or in media, what are your hopes and what are you looking forward to? And where is the Believe Her app going in this coming year?
Yeah, yeah. So I didn't get to unpack it too hard when we were talking about my day job at BET, but I do want to rewind just a little bit and talk about a really important study that my team led on Black content. So what we were up to on that was trying to define what will Black Americans or Black consumers say is Black content. And what we found is that it's important to have that representation, not just in front of the screen, but behind the screen as well, Gilad. And one of the top factors is having that authentic story. But when you kind of peel it back further, who's responsible for this, authentic story? And it's the writer. So actually, the writer, 7 in 10 Black Americans agree that the writer has the most important job on that set. And then it becomes the director, the producer, more the aesthetic roles like hairstylist, music, costume designer, but it really comes down to the writer. So when you bubbled up the question about representation and what that looks like in the future, it comes back to the writer. And we have to create those opportunities for writers, builders, content creators, app developers, visionaries. Like we have to create space and aperture for them to imagine, Black futures. We really, really do. So whether it's in Black maternal health or if it's for imagining futures and Black content, like we got to bring them in and allow them to unleash those amazing and incredible stories. I actually have a friend writing a beautiful piece in neo noir, and it's like this dark, crime kind of side of things, and it's like yes, like that is the nuance that I'm talking about because we love that too, and why not, right? So you've got to have that behind the camera as well too. So
You know,
I see a future where, you know, that you pipeline more of those brilliant minds in, you're going to get more of that brilliant content back out that truly mirrors and and puts voice to all those stories, so it could be Black women with disabilities, Black birthing people, Black genderqueer, Black trans lives. Like, those are the stories and intersections that we want and need to see.
I really do see that. You know where I have seen that is on Broadway recently in the past few years. I think that there is more telling of Black stories by Black creators. And being a big Broadway fan that I am, I specifically think about a couple of shows that I'd seen. There was Thoughts of a Colored Man. There was A Strange Loop, which I loved, and what I liked about those that, in my mind, looking from the outside, was that these were Black stories that were being told, it felt, to Black people and not
Yes,
necessarily to the white gaze.
that's right.
GAZE, not the white gaze.
Yes,
Um,
I
right,
follow.
they were dealing with topics that were by Black people for Black people. Strange Loop I thought was phenomenal about being Black and queer and how that is within the community. And so I've seen that develop, and I think it's a really eye-opening trend to have the authenticity and the courage to speak about these topics openly, no matter who's listening.
That's right. That's right. And you feel like the struggle, you feel the pain, you see the resilience, you experience the resilience, you're cheering them on. Like it really does cultivate no matter where you sit, if you're in the community or not in the community, but I think it closes that empathy gap as well too. When the higher the authenticity of the story, you do a much better job of closing that empathy gap.
Yeah, and it makes us understand each other better.
That's right.
Okay, so in terms of media, you're seeing that the trend is going to be more representation, like you said, both in front and behind the camera. What are your hopes and expectations in terms of Black maternal health and that community and Believe Her app? Where do you think that will be going? Where do you hope that will be going in 2024?
Yes, it's a great question. I am hoping that so when I think about this space and all the players, you have your policymakers, you have the nonprofits creating awareness such as ours, you have, those up to digital health transformation. There's so many lanes in this space. And what I want to see is like what I would love to see is like this massive big, and I'm putting it out there into the universe, this massive convening where we all truly get together in person. And Kimberly actually did it last year, and it was the first ever Black Maternal Health Gala, and it was spectacular. It was here in New York City, and there were so many folks honored that evening, and there was a little bit of dancing as well, and a DJ. It was so fun, and we got to truly experience joy because there is a lot of sadness and dark side and underbelly to this
Yeah,
work, and especially, Wanda and I, our own personal account with Shalon. It's hard. It can be re-traumatizing and
of course.
re-triggering to share, Shalon's story over and over again. However, we know that going back to humanizing the data, Gilad, like you have to tell the story in order for people to understand. And I remember this is probably 4 or 5 years ago now when Wanda spoke in front of Congress and told Shalon's story.
Mhm.
And you felt the just all eyes were on her and that they really got it and they understood what she was trying to communicate and the rallying cry for this space. So I say all that to say I'd love for all of the amazing collaborators in the Black maternal health space to just lock arms and get our like superhero team going on and just have a night or a day or weekend where we can really do this. And um, Black Mamas Matter, they do an BMMA alliance. They do Black Maternal Health Week, more like a conference style as well too, and that's coming up very shortly. But I'd love a bigger one where we just
Yeah.
all together, just stand in the fight.
Hopefully the fact that it is, making such a difference in women's lives provides some comfort and strength to continue to do it.
Juan and I spend a lot of time thinking about surviving children of Black birthing people. And I think of my best friend's daughter, Soleil, who is now 7 years old, same age as my son. And I think so much about all of the Soleils out there and who are living in the aftermath of losing their mom. And that's where Wanda and I spend a lot of time just sitting and thinking, what is the solve there? How can we, if you think about it from like a longitudinal data standpoint, I think the more recent view has been very cross-sectional, and you hear this, there are the stories there, but then it's like, what about the children and these long-term consequences? And what is the psychological impact, socio-emotional impact, and what kind of supports and services can be wrapped around them to really help them thrive throughout life.
It's good that there's the community to think about it.
Admittedly, we don't have the answers yet. We're navigating it as we speak, but it is certainly something we think about, because I think that the policies, the solutions, and the solves tend to be focused on the birthing person, and maybe surviving partner or husband. But I think a lens or focus needs and should be turned towards the children.
So if anybody wants to reach out, chat, learn more about the app or you, where can they find you or information about the project?
Yes, so they can go to our website. So Dr. Shalon's Maternal Action Project, easy search, Google will pull it up to the top. I'm also pretty easily accessible on LinkedIn. That's my main source of social media, and you can find me there, /BR Pryor, PRYOR.
Well, Bianca, thank you so much for visiting the Who's Your Data podcast. It was a pleasure having you and having a fascinating discussion.
Thank you for having me. It's such a warm and lovely conversation. I love that we got to go in so many different,
places.
So many places, and have so much fun while we did it. So I'm happy to come back anytime.
Anytime. Well, thanks for joining us today and listening to this episode. Please remember to subscribe, rate, and review our podcast. And if you have any questions you'd like addressed, send them to who'syourdatanow@gmail.com. That's who'syourdatanow, all one word, @gmail.com. Thanks, and see you next time on Who's Your Data?